Understanding Self-Harm and Suicide, Part 2. In this part of the mini lecture, we're going to think about the methods of suicide. We're going to have a look at the historical perspective and some interesting public health strategies that have been used, and consider the risk factors for suicide. So let's start off with some interesting history and public health strategies that have been successful in the UK. Before the 1960s, a common method of suicide was by coal gas ovens. Carbon monoxide was produced as a waste or byproduct of domestic gas using coal gas, and carbon monoxide is obviously very poisonous and can be very toxic and kill very quickly. So when people used to put their head in the oven and not turn the fire on, so they were just inhaling the gas and inhaling the carbon monoxide, and that was the method of suicide that was very common before the 1960s. And then around the 1960s, the coal gas was gradually replaced with natural gas, which is what we have today coming through our gas pipes. It was much cleaner, and that distinct odor was added as well. So that was much safer, because if somebody had accidentally left the gas on, previously it didn't have an odor, then when this distinct odor was added, it was possible to tell when you accidentally left the gas on. So coal gas was gradually changed to natural gas, which was thought to be so much cleaner and safer as well. And around that time, there was a noticeable decline in suicide rates in the UK. So although the change from coal gas to natural gas was mainly to do with cleaning up the air and making it safer for people, one of the positive unintended consequences of that was that there was a reduction in the suicide rate. So that really helped us to understand how public health strategies can be used, or government interventions can be effective on reducing suicide rates. Later on, we're talking a few decades later, legislation came in about buying over-the-counter medicines, and by that I'm talking about paracetamol and aspirin. So we will probably all have tried our luck with going to a supermarket and trying to buy 3 or 4 packets of paracetamol, and then the shop assistant stops us and say, "I'm sorry, you're only allowed to buy 2 packets of paracetamol." And that's because of legislation that's in place that says we're not allowed to buy more than 2 packets of paracetamol from one particular shop. And that has a significant effect on reducing suicides as well, by the method of paracetamol aspirin overdose. And that's essentially because it's buying extra time, buying thinking time for that person who is considering suicide by taking an overdose. If you have to go to different shops to buy it, and it's harder to stockpile those medications because it's harder to get them all in one go, that allows that extra thinking time for that person to reach out and seek help if they want to, or have that extra thinking time to really consider what they're doing. And suicide barriers have been an effective public health strategy as well. So suicide barriers, I'm talking about on bridges and in particular locations which are hotspots, or particular areas which have a reputation for suicide. And that's an example of a suicide barriers around a bridge. And some strategically placed phone boxes and Samaritan signs, and this breathing space sign as well, in certain hotspots with a reputation for suicide has also helped, because it allows that person who's thinking about suicide to perhaps reach out for help. Other things that have been effective include anti-stigma campaigns, so that could be through the NHS or government anti-stigma campaigns, but also there's tons of celebrities who are openly talking about their mental health difficulties on Instagram and all sorts of social media platforms. So this has become more acceptable to talk about, and the stigma is reducing when it comes to mental health issues. Of course, there's still a long way to go, and certain mental health conditions, particularly schizophrenia, still has some of the highest stigma associated with it. And then there's the availability of mental health support. So this is both NHS or mental health service support, so professional mental health services. So it certainly is the case that the provision of mental health support through mental health services and psychological therapies are better now than they were 20 or 30 years ago. In the last 10 years, there's also been that explosion of the service called IAPT, which is improving access to psychological therapies, which is about getting access to talking therapies much quicker than there would be in the past. And people can be referred to a service like IAPT, or they can self-refer as well. And also there's been a lot of other third-party and informal mental health support available through charities like Samaritans or Breathing Space or Mind. And they've had a lot more support and funding in the last 10 to 20 years as well. And then there's been a shift towards safer antidepressant medications. So that's sort of guidance for healthcare practitioners and doctors who prescribe medications. So by this, I mean, there's many antidepressants available, but there is a shift towards using the safer ones, such as the SSRIs, the selective serotonin reuptake inhibitors, and commonly a first-line antidepressant medication would be something like an SSRI, such as sertraline. And that's because it has well-tolerated side effects, it's effective, but also if taken in overdose, it's generally safe. So if you do have somebody who's depressed, there is always going to be a risk of overdose when somebody is depressed, and we have to sort of assess that with every patient who has depression. It might be low, it might be moderate, it might be high, it might be, you might not identify any significant risk, but we know that people do take overdoses, and if they take an overdose of sertraline, that's far safer than taking an overdose of amitriptyline. One really important point I wanted to make is that suicide is a worldwide public health issue, and it cannot just be left to mental health services to tackle suicide, because public health strategies have their role to play as well. And clearly public health strategies can be very effective in reducing suicide rates. So to talk about the history of suicide in the UK, so prior to the 1960s, suicide was considered a heinous crime. It continues throughout the world to be considered a crime in some countries, though the majority of countries have decriminalized suicide. But just to mention, there are countries where it remains a crime to commit suicide. But in the UK, suicide was a crime up until the 1960s. It was decriminalised in the Suicide Act 1961, and the first clause of this Suicide Act says, suicide is to cease to be a crime. So the legislation on suicide changes and it's decriminalised in the Suicide Act. And of course, when legislation does change, it leads the path for public perception to change, and it changes the stigma associated with suicide. One of the things to consider is the use of language. The legacy of suicide being a crime is this term, to commit suicide. So it's like to commit a murder or commit a theft. It's to commit a crime. It's much more preferable to use the words to complete suicide or to end someone's life by suicide rather than to commit suicide, though people still will regularly use the term to commit suicide these days. So it still remains a criminal offence to encourage, assist somebody to end their own lives. And the Suicide Act 1961 says it's a crime that would be triable on indictment. So that means it would be heard in the Crown Court because of the seriousness of that. And it could lead to a prison sentence of up to 14 years if found guilty of assisting someone to end their own lives. So there's been no change in that since the Suicide Act came into force. That remains a crime. But the key thing of that legislation is that suicide itself is no longer a crime. Okay, so question over to you. What is the most common method of completing suicide in the UK? And I'm using data from 2018 ONS statistics here, but I don't believe the situation's changed very much in the last few years. So what is the most common method of completing suicide in the UK? Write down your answer. Is it 1, overdose, 2, cutting, 3, hanging, suffocation and strangulation, 4, jumping from a height, 5, drowning, or 6, firearms? The correct answer is 3. It's hanging, suffocation, and strangulation. So hanging, suffocation, and strangulation is the most common method of completing suicide in the UK. And another very important statistic to remember is that 3/4 of those who complete suicide are male. So that's generally true across the globe, that men are more likely to complete and end their lives by suicide than women. There are some countries where the opposite is true and women are more likely than men. And in China, for example, women are slightly more likely to end their lives in suicide than men. But generally, and in the UK, which is where we're working, 3/4 of those who complete suicide are male. And being male is therefore a risk factor for completing suicide because they're more likely to complete suicide than women. And here's the tables from the ONS website. So the most common method of suicide is hanging, strangulation, and suffocation. The second most common is poisoning, and you'll see that women are more likely to use poisoning than men. And in the hanging, strangulation, and suffocation bars, you'll see that men are more likely than women to end their lives in this way. And then the less common methods include jumping or lying in front of a moving object, drowning, fall or fracture, using a sharp object, such as stabbing yourself with an object. And then lots of things come into this other category. So things like firearms would come into this other category. This is the data for the UK. So firearms or shooting yourself is not a common way of ending your life by suicide in England and Wales. It is more common in the USA, and that's because of how common guns and firearms are used in the USA. And in the UK, of course, when it comes to firearms, the strict licensing laws, and the police have to grant the license for a firearm. And before they do that, they have a obligation to check with the client's GP if they've got any mental health issues that would make them unfit to hold a gun license. And also the police do have the right to revoke the license if they feel somebody is of unsound mind and unfit to be entrusted with a firearm. If you meet a client who has expressed some suicidal thoughts and they've come up with a plan to end their life by shooting themselves, although it's not a common method to do that in the UK, the next question you would need to ask is, do you have access to a gun, whether it's your own gun or somebody else's gun? And if they do, we need to consider that as something we need to remove from them to reduce their risk of suicide. So we would have to check the Home Office guidance on this. There is some available. And we'd have to think about whether we need to inform the police so that they can investigate and remove that license and remove that gun if there is a risk to other people or a risk to that person themselves by suicide. So just to summarize that brief section, we've started off by talking about the historical perspective of suicide and some public health strategies, and about the methods of suicide that are commonly used in the UK. And in the next section, we're going to talk about risk factors for suicide and risk assessments.